Patients are scared of doctors and doctors are scared of patients. This silent fear shapes almost every interaction in Indian healthcare today. And to understand how we reached this point, we need to go back to a story that changed everything. The year is 1995. Jeevan Lal is admitted to a private hospital in Ludhiana, Punjab. Late one night, his breathing suddenly worsens. The family calls for help again and again. For nearly 20 to 25 minutes, no doctor arrives. Panic builds. Finally, Dr. Jacob Matthew and his colleagues rush in. They try to give oxygen, but the cylinder is empty. The staff scramble to find a new one. Minutes stretch. Pressure rises, and before a working cylinder is brought, Jeevan Lal passes away. The family, shattered, accuses Dr. Matthew of criminal negligence under sections 304A and section 34 of the IPC. The trial court convicts him. The Punjab and the Haryana High Court upholds that conviction. The case reaches the Supreme Court of India, where it becomes a landmark moment in Indian medical law. The Jacob Matthew case may seem distant, but the tension it exposed between patient expectations and medical realities is something millions of Indians still experience today. Today, imagine walking into a clinic with pain, fatigue, or discomfort you can't explain. The doctor listens, then orders a long list of tests, blood work, X-rays, scans. You spend thousands. Turns out, everything returns normal in the reports. The doctor says,
सभी tests ठीक है. See, everything seems to be normal. कोई problem नहीं दिख रही है.
And sends you home. But your body still insists something is wrong. This gap between what a patient feels and what the tests are showing is where many conditions often hide. And when reports don't capture this suffering, the patients feel unheard. So they turn to someone who does listen, the neighborhood pharmacist. It's very easy to just describe symptoms over the phone. भैया थोड़ा गला खराब हो रखा है, थोड़ा कोल्ड सा भी लग रहा है, कुछ लड़के के साथ भिजवा दो, and get an instant remedy. Often antibiotics, sometimes even steroids, all without prescription. Within days, the symptoms fade, partly because many illnesses are self-limiting. The relief feels magical, and the trust shifts from the clinic, from the doctor, from the hospital, to the neighborhood pharmacy counter, to the pharmacy wale bhaiya. But this convenience comes with a hidden cost. Across India, antibiotics are sold freely despite Schedule H and Schedule H1 rule. When taken unnecessarily or stopped early, the bacteria start developing defenses. It's almost like they're developing armor plates that make the next infection harder to treat. Every unnecessary antibiotic teaches the bacteria how to fight back. These resistant superbugs are multiplying rapidly. Infections like multi-drug resistant tuberculosis, stubborn urinary tract infections, and drug-resistant typhoid are rising and becoming more expensive and sometimes impossible to treat. Every time we misuse antibiotics, we strengthen the enemy. And the consequences are not just personal, this is a national issue. But the issue goes deeper than antibiotics. Let's go back to the court case that reshaped the entire doctor-patient relationship in India. When the Supreme Court reviewed the Jacob Matthew case, it focused on a key question. Was the doctor criminally negligent, or was this a tragic systemic failure? The court found the core issue was the hospital's failure to maintain essential oxygen supplies, not the doctor's individual actions. It ruled that doctors can be criminally liable only when there is gross negligence, far beyond a simple error or equipment failure. The court also emphasized the Bolam test, like what would another competent doctor have done in this situation? Would he have acted the same way or in a different manner? To protect medical professionals from harassment, the court recommended that an independent expert medical opinion should be obtained before charging the doctor with negligence. This judgment changed the behavior of doctors across India. After this ruling, new fear entered outpatient clinics. The doctors realized that even one unexpected outcome could drag them into long legal battles. So they began overprotecting themselves. More tests, more documentation, more rigid adherence to guidelines. The old family doctor model, built on intuition, relationships, and long-term understanding, started slowly disappearing. Evidence-based medicine is crucial, yes, but medico-legal pressure often twists it into a defensive medicine style. A simple fever now triggers a panel of tests, not always out of medical need but out of caution. And in this tug of war, the doctors are protecting themselves legally, their asses are covered. The hospitals enforce rigid documentation and protocols. The pharmacies are able to offer fast, friendly fixes without any scrutiny. And the patients spend heavily on tests yet still walk away confused and unwell from the hospitals. This mismatch fuels distrust on all sides. And behind all this lies a larger crisis. India's public health spending has historically been very low. Rural areas face chronic doctor shortages. Millions fall into poverty each year due to the expenses that are out of pocket. Chronic diseases like diabetes, heart disease, and cancers are rising really fast. Private healthcare is growing but unevenly. And amidst these gaps, overburdened doctors and frustrated patients, they clash. So what is the path forward? To rebuild trust, India must revive the spirit of the family doctor. Professionals who balance empathy with evidence and intuition with investigation. Curbing unregulated antibiotic sales is urgent. Enforcing rules can slow the rise of superbugs. And public and private investment must grow not only in the hospitals but in primary care, community clinics, and preventive health. Technology and telemedicine can bring doctors closer to patients again, but only if designed to be accessible, affordable, and humane. India stands at a crossroads of sorts. One path leads to impersonal, test-heavy medicine and dangerous shortcuts from unregulated pharmacies. And the other leads to trust, balance, and care, which is human at the core. The choice will decide whether healthcare becomes a right for every Indian or a daily struggle for survival for many of us.